Sam Stewart, and my chosen specialty is urology. I've been interviewing for it now for the past few weeks, and I continuously get asked why. So my answer to them and to you is, well, I loved the OR. I love general surgery, except I didn't like that we would meet patients for the first time and then cut their gallbladder out, maybe see them one more time after that, and then never see them again. So I really wanted a specialty with continuity of care, as well as a broad spectrum of pathologies, and that's where I found urology. For me, I also was told by my general surgeon that I needed to go check out urology because they were the happiest 10 years into practice, and that was also very important to me. So with urology, you get a great patient continuity of care. You'll see patients for their ED or for their prostate cancer or anything of that sort for years and years and years. So you do get to establish those relationships with patients. So that was number one for me. Number two, the anatomy was fascinating, and you could also improve patients' lives just by allowing them to get a hard on, or by cutting cancer out of kidneys, or cutting out prostates, or removing their urinary tract symptoms for BPH. So simple treatments like that. And then there's always progress in this field of urology, and that's something I really wanted as well in a specialty. So for me, the osteopathic tradition of structure and function being reciprocally interrelated. I really identify with that, and surgery, trying to always fix the underlying problem, the structure, so that we can gain back our functionality. And I think the perfect example is with kidney stones. Um, we're just humble plumbers as urologists, so remove the obstruction, and then everything can get back to functioning like it did. And it relieves a ton of pain for our patients, and that was very important to me. And sometimes that means cutting cancer out, and trying to heal the body that way by restoring the body's natural, like, genetics, and or not genetics, but restoring their natural function, even though their genetics had failed them to predispose them to cancer. And then I do want to focus on the patient as a whole, because so often we've got prostatitis, or chronic pelvic pain syndrome, and we really need to approach the patient as a whole.